Did you know that traumatic brain injury is the leading cause of death and disability worldwide among people under the age of 45? A traumatic brain injury, or TBI, happens when a bump, blow, or sudden jolt disrupts the brain's normal function. Every year, in the United States alone, about 2 million people experience a traumatic brain injury. And more than 5 million Americans are living with a TBI-related disability. That is roughly 1 in 70 Americans. Brain injuries affect much more than movement and speech. They can also change the way we think, remember, and regulate our emotions. Because many of these effects aren't visible to others, TBI is often called a silent epidemic. Brain injuries range from mild to severe, with moderate and severe injuries often requiring hospitalization. However, most TBIs are mild, and the most common type is a concussion. A concussion is a mild traumatic brain injury that temporarily disrupts normal brain function. Contrary to popular belief, you do not have to lose consciousness to have a concussion. In fact, a lot of people continue their day without realizing their brain has been injured. Many people never seek medical attention after a mild head injury, especially if they don't experience immediate symptoms. Even among those who do seek care, mild TBIs are frequently underdiagnosed because they often don't produce obvious structural changes on standard brain imaging. It's also important to know that symptoms don't always appear right away. Hours or even days later, people may develop headaches, dizziness, nausea, balance problems, sensitivity to light or noise, fatigue, or confusion. Because every brain is unique, recovery can look very different from person to person. The brain responds to injury by reorganizing and adapting. And while many people recover well, others experience lasting effects. As a result, the initial severity of the injury does not always predict long-term outcomes. The Lancet Commission on Dementia indicates that moderate and severe TBIs are associated with an increased risk of developing dementia later in life. Ongoing research suggests that some individuals with mild TBI may also be at higher risk. In older adults, a traumatic brain injury may sometimes be an early sign of an underlying neurodegenerative disease. Since conditions like dementia can increase the risk of falls and other accidents. So, how can you protect your brain? If you hit your head, seek medical attention, even if you feel fine at first. Since symptoms can develop days or years later, having the injury documented in your medical records may become important if problems arise in the future. Motor vehicle crashes and falls are the leading causes of traumatic brain injury, but some sports injuries, assaults, and intimate partner violence can also cause serious brain injuries. While not every accident can be prevented, there are simple steps you can take to greatly reduce your risk. Wear your seatbelt every time you're in a car and follow the speed limit. Wear a properly fitted helmet when biking or participating in high-risk sports. And if a concussion is suspected during sports, stop playing and seek medical evaluation before returning to activity. As we age, regular strength and balance exercises and making the home safer can help prevent falls. Protecting your brain today may help protect your brain health for years to come. To learn more about keeping your brain healthy at any age, visit cognitivevitality.org.